Moving can be an overwhelming experience, especially when it potentially involves downsizing or coordinating an emergency move for ourselves or a family member. Joining me now to talk about some of the challenges seniors may encounter when relocating and how to make it an easier process is Pat Dunn with Consider It Done. Pat, thanks for being here.
Thank you for having me.
Well, I've been looking forward to having this conversation because it's something that I think people may not always think about. What made you start specializing in relocation for seniors specifically?
Really, it's twofold. I'm a military brat, so we moved around about every 2.5 years, so moving was part of our lifestyle, but also being the closest to my parents in proximity as they were aging. And then my original background has been in healthcare for over 20 years, counseling with families and the patients and the families, preparing them for either going to go home or if they were having to go to a new facility or a new location, or if they were going back to live with their children out of town. So it's kind of a mixture of living it and doing it and helping my parents go through that process. My mom was diagnosed at a very young age at 63 and passed away at 66, so I had to help my dad with a lot of downsizing and getting the two of them to an appropriate setting so he could have some relief while caring for my mom. And then as time went on, extended family members asked me to help, and friends of friends, and so finally I realized there was a real gap. And it's happening across the country, and as we've talked before, being in a kind of a retired panhandle, oftentimes there's not any children down the street or across town, and so they're looking for resources and knowing what's out there.
So you're bringing lots of knowledge from different perspectives to this process. Well, I know you say that each move is different, and why is that really important for people to understand?
Again, I think going back to my healthcare background is every admission to a hospital is uniquely different. Some of it's elective or preventative reasons, or it's an emergency. Same thing with downsizing and planning a move. I just moved a couple from Gulf Breeze, and their children live out of town. They've been in their home for 30 some odd years, lovely home, 3,200 square feet, to a lovely 2-bedroom, 2-bath apartment. And I usually ask during my free consultation and my initial visit, why are they deciding to move? And usually one is real happy about it, and sometimes the other one's not on the same page, but they're getting there. But at the same time, they decided they wanted to do it when they were healthy, and they were doing it really as a gift to their children, and they were getting everything in order, from a living will to getting moved, downsized, and making sure family members have pieces of some of their lovely collectibles. They had traveled in Europe, and you could see some of those lovely things, but they weren't going to fit in that apartment.
Right. Well, when you have these free consultations with are there sometimes extended family members, say children, or is it just with a couple, or maybe a single person? Is there a family dynamic involved in some cases?
And then that's where they're all very different. The couple that I just mentioned, children were out of town and said, Mom and Dad, y'all handle it and let me come down if you need some help. The other ones, I'll meet with them, and then their children are coming into town, so that free consultation will turn into two visits or sometimes.
So what do you see as the biggest challenge for people when they start this process and this discussion and conversation?
I think it's a bit overwhelming, especially if you've resided in a home for 5, 10, 25 years. You really don't know where to start. It's also very difficult, I think, if you're doing it under an emergency situation that you've just found out that you can't go back home.
Right.
But I think helping them see that there can be an organized plan, there can be a timeline set up. I work closely with a number of the facilities in town, know their guidelines, and then sort of take a lot of the mystery, a lot of the questions away, and then knowing that if they want their family involved, we do a lot of consultation on the phone.
Well, when someone is looking for a smaller place, whether it's an apartment, condo, or whatever, what are some things they need to look for and think through in terms of, is this going to be a good place for me now, and will it continue to be a good place for me for several years so that I can age in place?
And that's a new term, aging in place. And most people, I think, if you were to poll them, and there's lots of polls, people would prefer to stay in their home. Sometimes that's really where I come in and kind of declutter, reorganize, encourage to take away certain area rugs, look at the bathrooms for them, make recommendations to, again, use a lot of resources in town, who does ramps, who are some of the home care providers that can come in and assist. And so my role in that move or consultation is really helping them look how to stay home and work with the children along the way as well. But as they're looking at smaller places, most people and that I've dealt with already kind of know what they want to do. They either want to go to a patio home, they've looked at floor plans, or they've looked at some of the retirement facilities in town. We have a wealth of opportunities along the Panhandle as far as patio homes and planned retirement communities as well as assisted living facilities.
What do you see, obviously, if you're moving to a smaller place? We can't take everything to the new place with us. What do you see are some real challenges for people getting over the having to downsize and reduce the amount of things that they're
very attached.
Take with them?
We all get attached to our collectibles and our family pieces, and so I have to put on that mediator hat sometimes to say, if you take this, we can't take this. A lot of seniors in this area have grand pianos and large clocks from Europe, and trying to find a space for that. So I'm also a certified stager, so I know how to go out to the new facility or look at the floor plans with them and say, the 2 recliners and the demi sofa can go, but the large couch really probably is not going to fit. But if the large couch is where mom likes to be and husband likes to be in the recliner, then we try to make that work, as well as making them make a list of what they really want to take. And then we try to make that happen. And if it can't happen, I can usually give them a reason why it's not going to be feasible to fit.
Say someone is wanting to stay where they are but make some modifications. What are some typical things they should either consider, or just, you mentioned rugs, what should they look out for as a possible danger?
Well, depending on if their medical condition has changed and they're now using a walker or they're using a scooter, then rugs can be a really challenge. They can be a safety hazard, as well as just having so much in the house. It may be that we just need to downsize some of their furniture pieces and see if family wants them. Or I work closely with appraisers so that we know the true value of some of these family pieces, and making sure if they do decide to sell them or put them on consignment, that they know it's going to a good home.
Okay. Well, that's great information. Well, thank you very, very much, because I'm sure there is a great need for these kind of services. So appreciate you coming and sharing with us this morning.
Thank you, Jeff.
We'll be right back with more Coming of Age in St. Christopher's Episcopal Church's 57th Annual Christmas Caravan.